It is a very ambitious topic for a short 15-minute talk, but I'm going to discuss the new PI3 kinase and BTK inhibitors, second generation compounds from our standard Duvelisib and Acalabrutinib. And then I'm going to talk about a few of the new targeted therapies that are a little bit earlier in development, especially the XPO1 inhibitor selinexor, some of the new antibody therapies, and other targets of the B-cell receptor pathway like SYK. With both the PI3 kinase and the BTK inhibitors, the focus has been on trying to improve efficacy with differences in selectivity and also minimizing toxicity. So with the PI3 kinase inhibitors, we have two that are pretty late in development, not FDA approved. One is Duvelisib, which is a PI3 kinase gamma delta inhibitor. So the idea there is that we're inhibiting both T cells and B cells, so inhibiting both the CLL cells themselves and their immune microenvironment. And then the second inhibitor of PI3 kinase is a pure delta inhibitor, TGR-1202. That one as well is in phase 3 trials, and that one compared to Duvelisib seems to have a really nice safety profile. So the things that limit Duvelisib administration long-term are colitis, sometimes LFT abnormalities, and the data that's been presented thus far with the TGR compound suggests that there's really minimal toxicities of that regard. And then in terms of the BTK inhibitors, there actually are three that are kind of later on in development. Probably the furthest along is Acalabrutinib, which is more selective than Ibrutinib, doesn't inhibit ITK, which might make it a better antibody combination therapy, and also it also does not inhibit EGFR, so it may have less toxicity because of that. And then there are two other irreversible inhibitors that I'll discuss, and then I'm going to talk a little bit about some of the up-and-coming non-covalent inhibitors of BTK. Those ones, so because they're reversible and they act outside of the C41 residue, they might be beneficial in patients who progress on Ibrutinib or other BTK inhibitors with C41S mutations. They don't have names. The first one is GDC-0853. That one actually has completed a phase 1 trial, but the results haven't been reported yet. The other two are SNS-062 and ARQ 531, and those ones have not yet reached the clinic.